Surgery is usually the first-line treatment approach for patients with spindle cell mesothelioma whose cancer is localized to the lining of the lung or chest cavity and has not spread to distant sites. The goal of surgery is to remove as much of the cancerous tissue as possible. For epithelioid mesothelioma, the standard surgical procedure is called an extrapleural pneumonectomy, EPP. During an EPP, the surgeon removes the entire lung, the lining around the lung, parietal pleura, the diaphragm, and part of the outer lining of the heart. Some surgeons also remove nearby lymph nodes to check for cancer spread. However, EPP is a very invasive surgery that can significantly reduce lung capacity and is associated with high morbidity and mortality rates. For spindle cell mesothelioma, the standard surgical procedure is usually less extensive than an EPP since spindle cell tumors tend to be localized. Common surgeries for spindle cell mesothelioma include pleurectomy, decortication, PD, and extrapleural pleurectomy, EPP. During a PD, the surgeon removes the lung lining, visceral pleura, and the parietal pleura surrounding the lung. For an EPP, only the parietal pleura is removed, leaving the lung intact. Both PD and DPP aim to remove all visible tumor tissue while preserving as much healthy lung tissue as possible. Removing part of the diaphragm or nearby organs may also be necessary depending on how far the cancer has spread locally. Unfortunately, even after surgery, mesothelioma often returns due to microscopic residual disease. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells and shrink tumors. For mesothelioma, radiation therapy is most often used as a supplemental treatment along with surgery and/or chemotherapy. There are a few different ways radiation therapy can be delivered for mesothelioma. External beam radiation therapy, EBRT. This is the most common type of radiation treatment for mesothelioma. A large machine delivers radiation precisely to the area of the body affected by cancer from outside the body. EBRT is usually given daily in short outpatient sessions over several weeks. It may be used after surgery to kill any remaining cancer cells near the surgical site. Intensity modulated radiation therapy, IMRT. This advanced form of EBRT uses computer-controlled X-ray beams to deliver precise radiation doses to the tumor area while minimizing exposure of healthy nearby tissues. IMRT allows a higher dose of radiation to be used and better conforms to the shape of the tumor. Internal radiation therapy, brachytherapy. For this treatment, radioactive material in the form of seeds, wires or catheters is temporarily placed inside or near the tumor. It delivers higher and more concentrated doses of radiation directly to the cancer. Brachytherapy is sometimes used along with EBRT for mesothelioma. Proton beam therapy. This type of external radiation uses protons rather than X-rays to treat cancer. Protons deposit most of their energy at a specific depth in the body, allowing doctors to deliver higher doses of radiation directly to the tumor while doing less damage to surrounding normal tissues. Proton therapy may be an option for mesothelioma in certain situations. Chemotherapy uses anti-cancer drugs injected into a vein or taken by mouth to destroy cancer cells throughout the body. For mesothelioma, chemotherapy is usually used in combination with surgery and/or radiation therapy to kill any cancer cells that may remain after these local treatments. It can also be given to help control the cancer's growth or spread. Platinum-based doublet or triplet combinations are considered the standard first-line chemotherapy for mesothelioma. Common platinum-based regimens include cisplatin or carboplatin combined with pemetrexed or raltetrexed, gemcitabine and vinorelbine or other chemotherapeutic options as well. While chemotherapy can help prolong survival, mesothelioma has traditionally been resistant to standard chemotherapy drugs. Recent studies have shown that multimodality treatments involving surgery, radiation and aggressive chemotherapy may have the best chance of controlling mesothelioma. However, the prognosis for advanced mesothelioma still remains poor. Targeted drug therapies and immunotherapy seek to enhance the body's natural defenses against cancer or interfere more directly with cancer growth and spread. Some targeted therapies are helping improve outcomes for mesothelioma. 2 immunotherapies have been approved by the FDA for use in advanced malignant pleural mesothelioma. Pembrolizumab, Keytruda, an anti-PD-1 antibody that helps block the PD-1 protein on T cells and activates the body's immune system to fight the cancer. Approval was based on a phase 2 clinical trial showing effectiveness in pre-treated patients. Nivolumab, Opdivo, another anti-PD-1 drug that works similarly to pembrolizumab. Approval was granted based on a phase 3 study that found nivolumab provided better overall survival compared to standard chemotherapy in relapsed mesothelioma. Promising new targeted therapies under investigation for mesothelioma include bevacizumab, Avastin, which inhibits blood vessel growth to starve tumors, ruxolitinib, Jakafi, a JAK inhibitor, and volociximab, an anti-angiopoietin-2 monoclonal antibody. Clinical trials are helping identify new combination strategies and more effective treatments. However, achieving long-term remission remains challenging. Symptomatic and supportive care aims to relieve the symptoms and side effects of the cancer and its treatments and improve quality of life. Pain management, nutrition support, drainage of fluid buildup, and occasionally radiation are used to help treat symptomatic pleural mesothelioma. Managing breathlessness, cough, and chest pain can help patients feel more comfortable. Support groups, counseling, and home care services provide important emotional and practical support as well. Integrative therapies such as acupuncture may help some patients cope. Overall, a multidisciplinary approach including an array of medical, surgical, and supportive care options often provides the best outcomes for mesothelioma. For potentially resectable spindle cell mesothelioma, surgery such as PD or EPP combined with chemotherapy and/or radiation therapy offers the best chance of long-term control. For advanced or unresectable disease, aggressive chemotherapy, newer immunotherapies and targeted therapies may help prolong survival, although the prognosis remains poor. A multimodality treatment plan tailored to each patient's circumstances along with attentive symptomatic care aims to maximize quality of life and survival time. Continued clinical research into the biology and new treatments for mesothelioma brings hope that outcomes will continue improving. A multidisciplinary team approach individualizing care provides state-of-the-art management for people facing this challenging cancer.